心血管疾病係全球嘅頭號死因，喺2016年，死於心血管疾病嘅人就有超過1700萬人，估計去到2030年，死於呢個病嘅人將會攀升至2360萬。患有嚴重嘅心血管疾病會有機會誘發心肌梗塞，對心臟造成永久嘅傷害，甚至係危及性命。心肌梗塞簡單啲嚟講就係冠狀動脈閉塞，係因為血流急劇嘅減少或者係中斷，而令至部分心肌因為嚴重嘅持久性缺血而壞死。心肌梗塞之後，心肌同埋血管系統都會嚴重受損。成大就研發出一種雙管齊下嘅方法，利用2種幹細胞同時修復心肌同埋心臟血管。究竟係點樣做到嘅呢？我哋就等成大生物醫學系潘基苑博士同埋佢嘅團隊介紹一下呢個創新嘅雙幹細胞療法啦。
We only have 2 potential options for those patients. The first one is heart transplantation, and second one is artificial heart device. However, heart transplantation always have lack of donor to provide new heart to the patient. And second option, artificial heart device, has lots of side effects reported. So in last 20 years, stem cell-based cardiac regeneration therapy has received lots of attention as considered as a promising therapeutic option for patients. Since heart disease excessively damages both cardiac muscle and cardiac vessel, which are 2 major components in the heart, we seek to develop 2 major component repair at the same time by using 2 different types of stem cells. To regenerate cardiac muscle, we used cardiac myocyte differentiated from human pluripotent stem cells. Those cardiac myocytes display very similar characteristics with human cardiac myocyte. By using them, we regenerate cardiac muscle. To repair cardiac vessel, we employed human mesenchymal stem cell from bone marrow, because human mesenchymal stem cell has been well known to secrete several good factors to improve cardiac vessel. So we deliver these 2 different types of stem cell into 2 different routes, one by injection, one is by patch. Our study is the first study delivered 2 different types of major stem cell into 2 different routes, improve cardiac function, survival of cardiac myocyte, and improve the vascular regeneration. As a result, we observed that 2 types of stem cell delivered 2 different routes really improved heart function and increased vessel regeneration, so there are more vessels. So we believe that some secret factor from the human mesenchymal stem cell patch make cardiac myocyte more mature, survive better, and junction better, so that there should be increased cardiac function.
研究團隊已經就今次嘅研究成果提交咗專利申請，接下來佢哋將會作更深一步嘅研究。